all, we have Jonathan Shaw, who's our Minister for Disabled People. We have Mark Harper, who is the Conservative Work and Pension spokesperson. And we have Celia Thomas, who is Lib Dem Work and Pension spokesperson. Welcome, all three of you.
And if I think about my time as a care worker and a social worker, really it was about disabled people were passive recipients of what the Council and Health Authority said they should receive in terms of services, and that still operates now. And I can envisage situations where we'll have groups of disabled people very much sitting in the commissioning power base, being able to interview, look at services for their particular needs, as well as having the individual rights. It's essential that we have these two conversations about care and support and the right to control in harmony, understanding what the future might look like, how that will help us achieve our goal of independent living.
Conference a month or so ago, our work programme, which was an update of our green paper, which really is an ambitious programme to cover not just those on incapacity and employment support allowance, but also those who are on job seekers allowance as well, a simplified programme to cover everyone on out of work benefits. But rather than there being one programme for one group of people and one programme for another group of people, the idea is to have one programme, but the support that's delivered to individuals is very personalised. And we want to use the private and voluntary sector, but critically be very robust about paying them by results. They're not going to get paid just for dealing with people, they're going to be paid for getting them into work. And by work we mean a sustainable job. And we're thinking about looking at that over a period of a year or so. Recognising though that many people who've been out of work for a long time or have very severe disabilities may require a great deal of help. We're not just going to have a flat fee, we're going to look at paying people differential amounts so that those providers will not just cherry pick the easiest to help, but they'll actually have a financial incentive to deal with everybody. We will use the savings we make from getting people back into work, from the benefits we're no longer having to pay them because they're in work, to reinvest into those programmes, which means that we can genuinely have the ambition to tackle the scale of need. Now the government again want to move in this direction, but they aren't being as ambitious, and they're, I think, investor save pilots they're called, will only start in 2011, will then take 3 years. They're trailblazers, I'd say they're a little bit more of a damp squib than a trailblazer, and will only cover 10 to 15% of those on incapacity benefit or employment support allowance. So until 2014 you're not really covering the scale of the challenge. Everybody who wants the opportunity to have an individual budget, to be able to take more control over their social care, and that's particularly important for those people who are of working age, where the evidence says that they will get significant benefits, and it'll be key to getting a lot of people back into work. If their social care support isn't fitted around their needs, the needs of their employer, they're not going to be successful about getting back into work. And the government's made some steps in the right direction on this, but it isn't going fast enough for the scale of the challenge. Social Care Green Paper says that all the models in that Green Paper are predicated on removing attendance allowance and disability living allowance for those people who are over 65 and using that money to go into the local government means-tested social care system. And we don't think that's a sensible step, and we've said that we will oppose it and we will campaign against it. And this morning my colleagues Andrew Lansley, the Shadow Health Secretary, and my boss Theresa May, the Work and Pension Secretary, made it very clear that we will do absolutely everything we can this side of a general election to make sure that doesn't happen, and it absolutely won't happen under us.
And I should say at the outset, I receive disability living allowance, and in fact that brings me to the first topic, because touched on by Mark, and we all know that the threat to disability living allowance in AA for the over 65s, the threat being wrapped, the whole argument about being wrapped up in a new funding structure. But part of the problem is a three-legged stool on which the social care system rests: benefit system, health system, and social care system. The first two, of course, being national, the third being local, with their different definitions of need. And I fear a lot of my emailers just didn't trust local authority provision. They thought it would be very patchy and council wouldn't afford it and it would soon be lost. Of course, one of the things that is being lost in this whole debate is that DLA is awarded to cover the very real extra costs associated with disability, such as keeping one's house warmer, that able-bodied people need, and has a different purpose from social care. The bill, which is being introduced to enable those older people in greatest need of care to receive free personal care in their own homes. It's something we welcome, although Neil Dixon of the King's Fund had a good point when he said it's odd to have a piece of legislation on a topic which is being widely consulted on, being introduced in isolation from the rest. For that is the very worrying rise in the number of people who are failing the new work capability assessments and who are being told that after 6 months on ESA they will have to go on to the harsher regime of JSA. I think it's all very well to say we should focus on what people can do rather than what people can't do, but some people who have quite severe health problems seem to be falling foul of the system. And I hope it will find a bit of resonance with some of this audience. The DDA was, of course, a breakthrough and transformed life. And we were talking about this on the way up. It really has made all the difference, with many buildings having disabled access and disabled toilets available as a matter of course. But the problems of access haven't gone away. There are still huge problems of access to public buildings, shops, theatres, hotels, restaurants, leisure facilities, which people who are able-bodied don't realise. The problems are still there. And I was just saying to the Minister, I have English heritage in my sight, I'm afraid, who seem to think the look of a building is always more important than a discreet handrail where there are steps, for example. Their grit seems to extend ridiculously to places like hotels, even in places like Bournemouth. Anyway, we have a long way to go, and the Disability Alliance is fantastic the way it campaigns on these subjects, keeps them all in the front of all our minds, and so I thank them very much indeed for that. And please keep on your incredible campaigning work. Thank you very much for listening.